Minister, karibu.
Thank you, Mr. Speaker, the Honorable Speaker of the National Assembly, the leadership of the House, Honorable Chairpersons of committees, distinguished members of Parliament, ladies and gentlemen, good afternoon. It's a distinct honor first for me to stand before this august House today, and I do it so with a very profound sense of gratitude. The journey to transform Kenya's health care system has been long and tedious, but it's a journey we have walked together. This House has been the bedrock of that transformation. Without your legislative wisdom, your oversight, and your bipartisan support, the milestone we celebrate today could remain mere aspiration. And for that, Honorable Speaker, I want to say asanteni sana, and we are happy that you stood with us. Honorable members, our mandate basically is anchored in the better agenda, the bottom-up economic transformation. When this administration took office, we made a very solemn vow that healthcare will no longer be a privilege for the few who can afford it, but a constitutional right for every Kenyan, as it is enshrined in Article 43. Health is not just a social service, it is a key economic pillar. And I say that with conviction that a healthy nation is a productive nation. We committed to shifting the paradigm shift from curative to preventive care, and from catastrophic out-of-pocket expenditure to social insurance model that leaves no one behind. To realize this, Honorable Speaker, this House undertook a historic legislative marathon. You debated, you refined, and you enacted 4 crucial laws that now form the legal spine of our healthcare system. And that is the Social Health Insurance Act of 2023 that established SHA and replaced NHIF, the Digital Health Act of 2023 that created the Digital Super Highway for Health Data, and the Primary Health Care Act of 2023 that operationalized the hub and the spoke model and the community health promoters. And finally, more importantly, the Facility Improvement Financing Act of 2023 that ensured funds raised in hospitals stay in hospitals. Honorable Speaker, let us be very honest about where we came from. Prior to these reforms of this administration, our systems was ailing. We had a very fragmented financing model where NHIF paid out more in fraudulent claims than it collected in legitimate premiums. We had no visibility of the patient data. We had no visibility of the patient records, and patient records were paper-based. Making portability was impossible. When I first stood before the ministry during my maiden speech on 1st of April 2025, the situation was critical. We were 6 months into the Taifa Care rollout, facing public scrutiny and systemic roadblock. I told the country then that, and I was given a name that I am a bulldozer, and that was for the right reason, to clear the way for universal health coverage, but to crush the bureaucracy and to build a system that works. Today, I return to report to the people's representative how that ground has been cleared, what we are building upon it. And I want to start with the first pillar, the pillar of sustainable health financing. I wish to begin with that pillar, and the transition from NHIF to Social Health Authority is the engine of our reform as an administration and a country. The numbers tell a story of unprecedented success and stability. As of 26 January 2026, we have registered 29 million Kenyans into the Social Health Authority. This mass registration has translated into tangible financial health for our system. We have collected 130.4 billion in contribution. And critically, we have disbursed over 93.4 billion to healthcare providers, both in public, in private, in faith-based, and in our national referral hospitals. Contrary to the inefficiency of the past, we are making great strides in settling all verified, validated claims. Currently, we have achieved an average claim settlement rate of 73% across the board. This means that money is flowing to our hospitals, ensuring that facilities remain stocked and operational. Honorable Speaker, as I say that, I want members to be cognizant of the Schedule 4 of the Constitution, that health is a shared responsibility, that health is a devolved function. A key component of this financing model was the realization through this House of the free primary health care, which has never happened in our country before. We are currently rolling out service charter to primary health care facilities across all the 47 counties. And we are doing this from last week because Kenyans go to primary health care facilities, level 2 and level 3, as the dispensary and the health center, but they are forced to co-pay. It's supposed to be walk in and walk out. So we have created now a charter, a green label charter, which we are going to fix, and we have started with the Bomet last week. We'll fix it in every level 2 and level 3 public, private, and faith-based health facilities. This charter, and I want to highlight that Bomet Health Center, which has the distinction of being the first facility to successfully roll out this charter. This charter is our promise to the people that at level 2 and 3 facilities, a Kenyan citizen should be able to walk in and walk out as an outpatient without paying a single shilling. We have already seen 800 million Kenyans have accessed services at the Primary Health Care Fund, proving that when financial barriers are removed, our people will seek care early, preventing complications and saving lives. To ensure that this safety net covers everyone, including Mama Mboga and Boda Boda riders, Honorable Speaker, in June of 2025, during Madaraka Day in Homa Bay, President Ruto launched the Lipa Sha Pole Pole initiative. We understood that the informality of our economy requires flexibility. This innovative payment model allows Kenyans in the informal sector to make a small, manageable contribution towards their health cover rather than a lump sum. This has democratized access to insurance, ensuring that economic status is no longer a barrier to quality health care. We are currently having over 410,011 active payers utilizing this Sha Lipa Pole Pole. And so far they have contributed over 1.4 billion, a clear indication that Kenyans are willing to pay for their health when given a dignified option. We are also committed, Honorable Speaker and members, to ensuring that the most vulnerable among us are not left behind. The national government is currently sponsoring over 558,000 indigent households, picked from the social health protection data in all our villages and all our counties and constituencies. And those 558,000 indigent households are having the Social Health Insurance Fund premium cover. I must also commend a number of counties, and one of the most best counties, Muranga County, which has set a gold standard by fully meeting its statutory obligation and sponsoring over 38,000 indigent households and remitting their full annual premium of the SHIF. And we asked more other counties, Makueni County, Kisumu County, most of our other counties are also preparing their list between 10,000 to 20,000 indigents so that they can pay for. Honorable Speaker, Furthermore, through the through the national government, CDF, a number of members of parliament have paid for indigents from their constituencies. And you can see the list here. And there are more that we are going to post. And I have asked the CEO, Honorable Deputy Speaker, representing a number of our women rep, has also submitted the list. And I've asked the CEO of SHA to make a dedicated desk and staff to attend to members of parliament, starting tomorrow once this workshop is finished, so that the figure is known, the figure has been agreed, and is a flat figure. And we want in your constituencies to give us the list. If you tell us to pick it from the database, we will pick it from the database, social protection. But we want our members of parliament, and they have been doing it even before. But right now, because members are asking me, how do we do it? I have directed SHA, now that they have a skeleton staff, to dedicate a specific desk that, and even come to parliament. The clerk of the National Assembly, through the speaker, can even give us a room within parliament where the SHA members can be accessed by members of parliament. Members of parliament do not, even your offices, your staff can access our team in parliament. But we really want. We have collectively together, we are sponsoring partners and development and philanthropies are sponsoring close to 62,000 if I add with the ones of members of parliament. But I want to urge the honorable members to utilize the national government CDF to sponsor the indigent in your constituencies, so that we mirror this success to ensure the universal coverage. Honorable members, for a long time, the overseas treatment scheme was a conduit for abuse between doctors in Kenya and hospitals in India and many other places, where cartels and these agents exploited the vulnerable patients and the public purse. That era is over under SHA. We have introduced a robust, transparent framework for overseas referrals that put the patient first and protect our resources. This new policy, Honorable Speaker, is anchored on a simple principle. SHA will only pay for overseas treatment if that procedure is not available locally. Because when you go to India, you are supposed to go with the whole family. It's more expensive for the family, and that is why we have to do a lot of harambe. And to enforce that procedure, I have appointed the Benefits Package and Tariffs Advisory Panel, a team of top experts who have vigorously assessed our local capacity. And I am pleased to report that the panel has successfully identified and listed only 36 medical interventions that are currently not available in Kenya. And these are the only conditions for which SHA will authorize treatment abroad. If you want to pay for yourself, it's okay. But under SHA, it must fall within the 36. The only conditions which the law allowed us. We have also introduced a very strict vetting protocols. Every referral is now subjected to a peer review by the claims office to ensure that the medical necessity is found. Honorable Speaker, we are also requiring that any overseas facility receiving a Kenyan patient must also formally empaneled and contracted by SHA. So you cannot go to India and walk to any hospital. The way we contract Aga Khan and Kenyatta Hospital, the facilities in the foreign nations must come and contract with SHA. And we do it online. Honorable Speaker, we have capped the minimum payable amount for this overseas treatment to 500,000. This will ensure the sustainability while granting access to life-saving procedures. This new framework guarantees that we are not going to exporting our patients and also exporting our money to support healthcare system of other nations. And let me repeat it. We will not export our patients and our money to support healthcare systems in other countries. We must be candid. We must improve our healthcare system so that the money can remain here and support our health facilities. Our patients can be at home, and many members know during the COVID, we could not even return the bodies of our loved ones when they pass in India. Because in some countries, the only thing that happens is cremation. Many Kenyans, particularly of the Christian faith during COVID, they could not bring back their bodies. Airlines have refused. Countries have introduced protocols. So we must build Kenya. We must retain our patients here, treat them, and we must retain our money. Honorable Speaker and members, the transition from NHIF to SHA is not merely a change of logo. It's a fundamental restructuring of our national health insurer to ensure efficiency, integrity, and professionalism. We are building a new institution from the ground, and this requires a fresh, competent workforce. And I wish to be categorical. Recruitment into SHA is strictly based on merit, unlike the NHIF, unlike the defunct NHIF. There is no automatic transition. However, Honorable Speaker, we were guided by the courts. The former staff of NHIF went to court, and we were guided by the law and the courts that we must give priority to competent, qualified former NHIF staff. The days of nepotism and incompetency are behind us. Only those who prove their worth will serve the people of Kenya. And Honorable Speaker, to make the record straight, to date we have only recruited 144 staff members, representing 17% of the total approved establishment of 815 positions. The initial phase focused on securing the top leadership and the core leadership and the technical experts needed to operationalize the authority, including the CEO and the directors. We are now doing a massive recruitment drive for 425 senior officers in order we decentralize them to our counties. And this exercise has been highly competitive. We have received 17,434 applications, and we are following vigorous shortlisting process. We have shortlisted 1,737. And Honorable Speaker, I want to categorically say the list that is circulating in the social media is a fake list, is not from SHA. And I am ready to present the truth. Yeah, there are people who doctored that list in terms of counties, in terms of tribes, for their own reasons. I have a full report before Parliament, and I'm ready to submit that. That list is fake. That list is meant the people who could not say anything about SHA. They have looked for anything under the sun, and they have generated a fake list. And I am ready to appear before the committee of even cohesion and integration. I think that committee still exists in the House. Yeah, I'm ready to appear before that committee and put everything on the table. But that thing which is going round is not from us. Honorable Speaker, let me go to the pillar number 2, comprehensive healthcare information digital superhighway. This superhighway has been the game changer in our history, where for the first time visibility of our healthcare sector, all our 47 governors, the whole leadership of MOH, the president himself has a digital dashboard that he can follow what is going on in the health sector. And Honorable Speaker, if you allow us, we can give Parliament also a dashboard that can be put somewhere. You can see even the bed occupancy of Kenyatta Hospital. We have successfully, up to today, digitized and linked 10,277 transacting faith-based and private hospitals into one digital superhighway. We have specifically have 4,149 public facilities that are now fully digitized, because slowly we are training and we are digitizing them as we move along. And to support the Taifa Care system, we have delivered 30,087 digital devices, including the biometrics. And that's why you see, Honorable Speaker, under SHA, there's no card. It is your thumb. Particularly now we have finished level 5 and level 6 and level 4. So that's why the digital devices I'm talking about across the country. And this is to ensure that the most remote dispensary can transact data in real time. Honorable Speaker and members, this digitization is not just about efficiency, it's about the potent weapon against corruption. The era of manual claims, opaque processes allowed theft to thrive. And that's why you see in today's headline, the 11 billion shilling lost between October when Shah kicked off to April when I took over, the system did audit. And we found facilities were stealing because they were used to stealing from NHIF. And how do they steal? So that 11 billion is rejection. We have presented. So that 11 billion is rejection. We have presented to the committee. And I will give you what are rejections. There are facilities in our country that have reported 100% of the mothers who came to deliver have gone through C-section. That is even against the WHO rule. The WHO rule, international accepted, is 10 to 15% of mothers who go to deliver in hospital will go through C-section. And I think the member for the vice chair of health committee, Honorable Pato, is here. When I went to Tharaka Nithi, one private hospital said 500 mothers came here, all of them delivered through C-section. If that happens, it's against the law. The former chair of health committee, Honorable Sabina, is looking at me. Shah will not pay. Secondly, we have hospitals who are saying they want to be paid for maternity and they are not providing two very important documents. The first document is the claim form. Claim form is in the law that you have passed. And even you, when you go to your doctor, a claim form, a legal document, is filled by 3 people. The patient must fill. You have seen your doctor or your nurse after they take the normal thing they tell you fill. Then the doctor fills. Then the hospital administrator fills. A situation where we find, Shah finds that claim forms are filled by one person, one handwriting, one pen. That is a rejection and we will not pay. It's part of the 11 billion. Thirdly, there are people who are submitting that maternity delivery has taken place in a facility. And any healthcare worker listening to me will know that when a baby is born in a facility, and there are doctors in this August house, there must be a very important document called birth notification. If you submit claim forms for maternity and there's no birth notification, how are we sure that a child was born? That is a rejection. We will not pay. It's part of the 11 billion that you saw today the nation has carried. Finally, the last one is when people make claims on surgery procedures that somebody has gone through the theater. There's something called theater notes. And you have seen, as the person is being taken to the theater, there is a file on top of the patient. That file carries the theater notes. So if you don't submit the theater notes to be part and parcel of your claims documents, how will Shah be sure to pay that claim and that procedure and surgery has taken place? I will tell you of something, even PhD, the primary health care facility, which is free outpatient. Now you know the system picks patterns. It's not human beings. These days there are no claim forms. You know, under NHIF, the claim and everything was done at the counties, by manual, by people. And they sit together. Now the system picks patterns. And this morning we have picked a pattern. Let me just add it. In fact, half of my team don't know. In primary health care, in one of our counties we have picked, there's a patient who's accessing one of our dispensary or our health centers in that county, in that facility, 10 times a day. Yes. The how is the rejection. The how is the fraud. The how is the 11 billion that we have. We have just picked it. And we have said it, we will have a conversation with the governor of that county. Because he wants to get more capitation, so he creates, the facility creates ghost patients, and they go in the morning, they come lunchtime, they come, but they don't know that the system picks. We have one patient whose dependent children were 381 in Kwale County. In Kwale County. And we are giving such patients, we are giving them to the DCI, and we want to, the DCI will ask, can you show us your 371 children? Because the system is speaking. It's not human beings. This system looks for patterns. It will even tell you how many surgeries have you done. Yeah, for dialysis, most Kenyans who go through dialysis, there are two, fully paid by SHA. There are some who go the third one, which they have to pay. If we see this patient going for 10 times dialysis, then that's not a dialysis patient. So the system has really helped us. This system, Honorable Speaker, has what we call AI-driven fraud engine. It's very active. It detects anomalies in real time. For instance, the system flagged the facilities claiming for procedures that they lack equipment to perform. We found one facility in a county where they told us level 3, they said they are doing C-section. So I walked into that facility. And I asked, the governor said that facility cannot do C-section because there's no theater. So I told him, let's go to it. And when I went and we found the gentleman running the place, the first question I asked him is, take me to the theater. And he says, I have no theater. The second question I asked him then, where are you doing these C-sections? Because you have claimed 65 C-sections in the last 2 months, which we have rejected, we have not paid him. So the engine really helped us. The engine also helped us inflating bills for patients who never walked through their doors. Following these system flags, Honorable Speaker, we have engaged the Director of Criminal Investigation to conduct deep investigation. I can confirm to this House, the DCI has so far concluded 24 files for 24 facilities implicated in fraud. Two of the former CEO of SHA are before court. A number of staff of SHA are before court. A number of owners of facilities are before court. 25 doctors, SHA has withdrawn their rights to access because the system picked a pattern of doctors in operating in 10 counties. The doctor is in Homa Bay, then he's in Kisii, then you'll find him in Garissa, then you'll find him in Malindi. So the system picked, and some of them were involved. So 22 doctors have been denied their access rights to the portal of SHA. They can go and treat somebody, but if they treat somebody, they cannot do it where the reimbursement of the patient is done. We have also denied rights to, I think, close to 36 clinical officers who we found them in fraud. Files for facilities such as there was a facility called New Manyalo Nursing Home and Brimaxa Hospital. These have already been forwarded to the Director of Public Prosecution. Directors of these facilities have been arrested and charged, and we are not sparing, and I want to say that both the leadership of this House and the President have given us the support that we required. For us to achieve this, we must make bold decisions, hard decisions, and we must always work in the interest of the people. And Honorable Speaker and members, let me be very clear. Kenyan money will not be stolen. The digital system we have built is a fortress. It's like Fort Jesus. It will allow us to track every shilling from the moment a Kenyan contributes. to the moment that shilling pays for either a pill, a medicine, or a procedure in a theater. If you attempt to steal from the sick, the system will catch you, and the government will prosecute you. That is the new order of the day. If you steal from our sick, the system will catch you, and the government or President Ruto will prosecute you. We have further secured, Honorable Speaker, digital sovereignty through our collaboration with the United States government through the data sharing agreement, which I have shared with Parliament. I am ready to defend it. That data sharing agreement, Honorable Speaker, is solid. It's done by our lawyers, and it even says where the laws of the two countries contradict, the Kenyan law supersedes. The people who have gone to court are the civil society and the NGOs who used to eat this money historical. The Kenyan patient, the HIV patient, the malaria patient is important. No system we have can function without hands that heal. And I want to thank this House for approving the budget that has stabilized our workforce. The first day I went to Afia House, I was welcomed by UHC staff demonstrating and doctors. This House has really helped me in approving a budget that has stabilized the workforce. Today we have posted our interns, we have transitioned our UHC staff to SRC rates, and by June this year, in the division of revenue bill, we will transfer the whole resources to the equitable share so that our counties can now absorb them as permanent and pensionable. Honorable Speaker, I must speak specifics. Often without pay, supervision, or tools. Today, they served with heart that they lacked the recognition. That changed in September of 2022, when Kenya took a bold step at a national event presided over by President Ruto. The government formally recognized and engaged 107 frontline community health promoters. These frontline workers, they are no longer volunteers, they are paid, they are equipped, and they are digitized. And come July, all the 107,000 will enjoy the social health insurance premium cover paid by chain for health products and technologies. We are reforming KEMSA into a very agile, transparent logistic entity that uses digital tracking to ensure the last mile of delivery of our medicines. We must ensure that a mother in a remote village has access to some life-saving drugs as a patient in the National Referral Hospital. Madam Honorable Speaker, if you allow me, we have introduced, I think, yesterday. We also picked a pattern. The system has picked a pattern where 50,000 patients in a county referral hospital go through the compound is surrounded by a myriad of chemists and pharmacists. Go to Kisii Referral Hospital. Even go to Garissa County Referral PGH. I was there this weekend and I was asking, why are there so many cases? If the patient does not, because the system will know, if you don't dispense medicine to a patient, then SHA will not pay for any medicine you claim. Since SHA started, about 946,000 women have delivered through the SHA system. As a country, annually we are about 1.5. The Director of Medical Services is here. And when we look at those 900 and plus women who delivered either through C-section or normal delivery, we have their names, we have their ID card numbers, we have their telephone numbers, we know their county, we know their constituency, we know the facility. That is how robust this digital system is. So to kill the story that there is no medicine in our health facilities, now If you don't give a Kenyan medicine and you claim for it, then SHA will not pay you. Then what will you be forced? You'll be forced to give the Kenyan. And the Kenyan will know from the charter he was supposed to get medicine for free, particularly under PHC. So KEMSA, as of today, the reforms we have done, KEMSA has a refill rate of 91. April, they had only, in every 10 drugs required, in April of last year, KEMSA had only 5. Today, in every 10 essential drugs that you ask KEMSA, they will give you 9. And we want to take it to 10. And we want KEMSA to buy from the manufacturer so that we reduce the price of drug. The cost of care in our country, healthcare, is very expensive, members. You must interrogate that. In a number of parliaments, 11th, 10th parliament, that discussion used to come. Why do we have one doctor charging you consultancy fee of 10,000 or 8,000, and you have another doctor charging you 2,000? There must be a standard. There is a standard among lawyers. There is a standard among engineers. There is a standard fee that architects can charge you. We must have, and I am sure I can see Professor Golicha looking at me, but sometimes we have to say it the way it is. We have to say it because we are defending the Kenyan patient. Honorable Speaker, just to highlight, because it's a matter before court, the importance of the U.S. government, Kenya Health Collaboration. This partnership provides over $300 million annually in support of our HIV, malaria, and TB programs. As we move towards the sunset of some of this international support, and I want to thank this House, Kenya was the only country that was allowed to come and sign in State Department. We were the first country to sign globally. And we are the first country that were allowed to sign in Washington, D.C. And that's how important Kenya is a leader in the healthcare. And many countries want to learn the universal health coverage and SHA from us. And most of it is because of the 120 county facility, 0.1 billion, which the government has not paid for, is fee for service. You go to a hospital, go through a CT scan. That CT scan, SHA will pay part to the hospital and part it will pay. You will find a private wing. Today, the number of referrals, very few Kenyans are referred to Kenyatta Hospital or Kenyatta University or MTRH or Jaramogi, because all our county hospitals now, majority of them have the latest equipment, dialysis machines, CT scans, mammograph. You'll find them in all our, reducing the burden. Kenyans used to die on the road. So when we talk about healthcare transformation with the support of our members, UHC is about ensuring that the quality of care received by a president is the same quality of care available to a peasant. To achieve this, we have entered into a strategic collaboration that are already bearing fruit. And I really want to ask my sisters who are in this room to listen to me. When I became the minister, that drug now is sold at 40,000. And that's why SHA is paying for the full treatment for our sisters and mothers who battle breast cancer. That drug cost was very prohibitive, and it was forcing families to hold fundraising or forgo treatment. Now under SHA, it's accessible at zero additional cost to the patient. We have also formalized our collaboration with Aga Khan University. I did a partnership with Aga Khan to allow SHA beneficiaries to access the specialized service like kidney transplant. You know what happened in Eldoret? And Honorable Speaker, I really want to indulge you today. An audit was done on what Medihill did in Eldoret. The way kidneys were harvested, the way foreigners were brought in illegally the kidneys of our people, of our young people, without regard to safety and ethics that comes with it. So today a Kenyan of any status can walk to Aga Khan as long as he has a donor. Kidney transplant will be done at the cost of SHA, 1.2 million shilling paid for, pre and post. Aga Khan used to be a hospital of the rich. Today, if you go there under SHA, at the dialysis center, you'll find in Nairobi Hospital, Nairobi West, in Kenyatta, you'll find all that. There are many people who say SHA is not working. If it's not working, then how come 29 million people have registered? There are some of the people who are saying it's not working. They are very sad because their county is number 2 or number 3 in SHA registration. For example, Nyeri is number 3. Number 1 is Mombasa. Let's clap for Mombasa. Number 2 is Bomet. Number 3 is Nyeri. Number 4 is Kirinyaga. I can continue. But for our colleagues like me who come from the Asal, if I start naming the bottom, that is where we are, including my own county. And I have to say it. But we must clap for the counties. Elgeyo Marakwet, Kericho, among the top. Lamu, among the top. As small as it is. Honorable Speaker, we have also have an agreement with Nairobi Hospital, a historic collaboration for kidney transplant at SHA rate. Honorable Speaker, these collaborations translate to one simple reality. We are demonizing the walls between the rich man's hospital and the poor man's hospital. Under SHA, every Kenyan has a seat at the table of quality health care. Honorable Speaker, I now want to speak to key moral imperative. And I want our sisters to listen to me. And this is the health of our mothers and children. Every woman, every newborn, everywhere, agenda. And our rapid result initiative that we carried as a ministry last month showed that 26 of our counties have drastically reduced their maternal mortality rate and newborn child death. But we have 25 counties which are in the red. We are trying to make sure that those 25 counties, we have an engagement with them at the level of the presidency and the Council of Governors, and no mother, Honorable Speaker, no mother should die while bringing. We are not doing very well. We are losing a lot of mothers in our facilities. And I want us to clap for the people from the former Central Kenya. Can you clap for them? The maternal mortality and new child born rates are very minimal. Those of us who come from Eastern, Western, Pastoralist, Nyanza, Coast, we have some work to do. And I am ready to lead from the front. I'll work with the leaders. That we are losing more mothers in those regions than any other part. Honorable Speaker, let me talk about the Kenyatta National Hospital, one of our world-class milestones. When I founded Kenyatta, and I'm happy to report today, the chairman of the Kenyatta National Hospital, the former Secretary General of Kenya Red Cross, through his corporate network, today we are refurbishing 9 wards in Kenyatta at a cost of 270 million, paid for by the corporates, banks. He went to Equity, he went to KCB, he went to many other organizations, and today they are refurbishing at a cost. Today, Kenyatta National Hospital has established the state-of-the-art HLA lab for organ transplant matching, ending our reliance on expensive foreign laboratories. We are not sending now tests to South Africa or to the CDC Atlanta. Kenyatta National Hospital is doing a lot to our community. Record-breaking surgeries you watch in the news every day. Beyond our borders, we want to position Kenya as a leader in global health security. And we have formed the Kenya National Public Health Institute. We have expanded our laboratories and our emergency operations centers. We want to build a resilient system that can detect and respond to pandemics long before they reach our doorsteps. However, Honorable Speaker, these gains remain fragile without a very strong intergovernmental synergy. And I want to urge the National Assembly to ensure that health remains a whole of government priority. Health security is inseparable from the work of the Ministry of Interior, ICT, Education, National Treasury, and many others. Honorable Speaker, let me come now to the legislative agenda as I conclude. We laid the foundation and we have secured the standard of care. And I wish to bring to your attention that there is a bill before the House called the Quality of Health Care and Patient Safety Bill 2025. This bill is critical bill is already before the House. It went through first reading on the 14th of August 2025 and has been committed to our Departmental Committee on Health. This bill will guarantee the safety for every Kenyan patient. It establishes legal framework to ensure that the care paid for by SHA is care that cures, not care that harms. And I want to give an example. When there are two mothers, pregnant mothers sharing a bed, that is not care. Do we agree? When we have a mother or a patient, even male, on the floor of a hospital, that is not care. Particularly in a cold place like Nyandarua. Do you know, have you asked yourself why there are no more Kenyans sharing beds? Do you know what we have done in the system? Every hospital, in their license, they have their bed capacity. So if your hospital has 50, we will not allow you to admit more than 50. Two, in the old NHIF, the two mothers who were sharing the bed and the one on the floor, both the three of them were paid by NHIF. So they were making money. Now we have said, and we watch the bed occupancy. If I had the Digital Health Agency CEO, we could have shown you, a good example, Kenyatta Hospital. Kenyatta Hospital ideally is supposed to have a bed occupancy of 1,800. But Kenyatta was admitting 2,200, extra 400. Today, if you go to Kenyatta, you will not find two mothers sharing a bed. But what I am doing is the system and administrative. I really want you to do that in legislation. We define care in that bill. A care of a patient, the dignity of the patient, the safety of the patient, the ethical standards of the patient are all defined in that bill. I really want to ask Honorable Speaker and members and our committee to fast track that bill in the first quarter of this year. It will really help us help our patients. Then we have a number of other bills that are in Parliament. The Health Act Amendment, the Public Health Act, the Tobacco Control Act, the Cancer Prevention and Control Act, the Food, Drugs and Chemical Substance Act, the Pharmacy. All these are amendments. They will really help us if they are fast-tracked. Honorable Speaker, finally, to sustain this momentum, we require your budgetary support. To clear the pending claims and ensure that seamless operations of free primary health care, we urgently require, we have already told the National Treasury, they have committed to us, but the Leader of Majority and the Chair of Budget can help us, them to release the 5.9 exchequer release, so that we can pay facilities for the month of October, November, and December in the primary health care, in the dispensaries, and in the health centers. But they have said they will pay before the end of this week. We also wanted the projection deficit of the PHC, and the chair of budget is aware, is about 11.9 billion, and we want it to be factored in between now and June. We want it to be factored in the supplementary budget. When we were looking at the maternity package, we realized the people who design SHA and UHC, they have left a very component. There are places where our mothers deliver in health centers. They deliver even in dispensaries. And sub-county or level 4 hospitals are very far from them. And after that discussion, and we did a paper, the summit chaired by the President, the Council of Governors, we have agreed now our mothers, because we want to reduce the maternal mortality, maternal and child mortality rate, we have asked now to be given more resources of 2 billion so that our mothers can now deliver in health centers and in some dispensaries in some of our constituencies. Honorable Speaker, and this is just to save our mothers and our newborns. Honorable Speaker, I have come with the very senior members of my ministry. If you allow me, PS Oluga is busy chairing. I left him in Nairobi to chair another workshop. I have PS Mary Mudhoni of public health and professional standards. I have the first Director General under the new Constitution of Health, Dr. Amoth, Dr. Masi Mwangangi, CEO, SHA, one of my directors from KEMSA, operations, and then Terry Rotich, who's the head of legal in SHA. I think those are the ones. Yeah, I have another team, the gentleman at the far end, the two gentlemen are two directors with Social Health Authority. Honorable Speaker, just to conclude, the state of our health care in our country is transforming. We have moved from a deficit-ridden NHIF to a more surplus-generating SHA. We have moved from a paper files to digital superhighway. We have moved from volunteers to paid community health promoters. This transition is unprecedented. It is working. It's what President Ruto and his administration have promised, and I request your continued support as we anchor these gains in law and practice. Thank you very much, Honorable Speaker and members. God bless you, and I'm ready to answer. Just to, in case members have issues with the headline of today, on the headline, the 11 billion are the rejections I have told you. Those are money lost in the sense that they have claimed we have found them. They are remitting. Some of them are going to court. Some of them have agreed to return back our money. And we have not finished. We have, I don't want to, you know, there are some things that belong to the criminal justice system. I don't want to speak for. I have the whole list. The biggest junk is the private hospitals, followed by the county hospitals, followed by the National Referral Hospital, including Kenyatta, MTRH. The lowest is with the faith-based hospitals. We have the names we can publish. There are rejections. They claimed for services they have not offered. And they have done all that I was telling you. And I am sure that many people, including those who are criticizing me, some of them, this morning they sent me a text message and they said those people must be prosecuted and they must return the money. You cannot eat the money that belongs to a patient in Kenya. Thank you, Honorable Speaker.
Thank you. Thank you, Waziri. Honorable members, you've heard the minister is with his team, Rachel. We're doing 10-10. Yes, yeah? Oh, Dr. Nyikal first. Lower your hands. We promise to give Dr. Nyikal 3 minutes.
Nyikal, just 1 minute. Honorable members, for those who walked in and out, let us first of all give a round of applause to the Honorable Duale. Indeed, Honorable Speaker, the Honorable Duale has done very well. In terms of making a presentation, we can tell when a presentation is good. And we are so proud that he is from this house. And it makes a difference when someone who has the experience that is required gives such a presentation. We appreciate. He has taken us through the journey that the transformation. He has given us the role, the pivotal role of Parliament in legislation and way forward and what assistance that he needs. He has given us a comparison of what happened in NHIF and what is happening in SHA, including the numbers, including registration, the depth, including the amount of money that is being paid in and out, the role of national government and the counties in health, and the complications therein and what support that he needs. Honorable Speaker, he has also given us assurance that it is not about your economic power that will make a decision on your access to health. These are the kind of presentations, Honorable Speaker, that we want. Mr. Speaker, he has given us this House assurance that we are not going to export our patients and also export our money. The measures he has put in place, we like that. Thank you. And now I'm going to give a chance to Dr. Nyikal. Welcome, Dr. Nyikal.
Okay. Mr. Speaker, let me first of all appreciate the Cabinet Secretary for the presentation. I'll not say much because this today is the presentation of the Cabinet Secretary to the House. So the members will deal with that. Most of the issues he has raised, we have actually discussed with him in the committee. We have had interactions, some of which you have seen on TV, and these are the results. I'll just make very few comments. One, there are some issues he has raised that we'll still have to look up with them as a committee. So I don't expect to say much on them. We'll have opportunity as a committee to call the team and have that. But the only ones I want to say that are really important is the issue of registration and payment of premium, which is a gap of 29 million and 4 million. It has issues. The issue of county and national government coordination, and that is what affecting KEMSA, not getting drugs there because drugs are being bought at the county and they are not paying KEMSA. So that is something we will discuss with them. The issue of primary care fund, which we actually gave this time, and that has to be used at the county level, in level 2 and level 3, where he actually we agreed as a committee that women do deliver there, they should be paid. So we look at that. Then the issue of human resource transition, the one of NHIF to SHA, is again something we'll sit down and look at. The issue of UHC staff and interns and global fund, I must congratulate the budget committee, Chair Atandi. As a committee, we managed to put some money there, and for the primary care, we are also going to put money so that women can deliver in level 2 and 3. And the other issue of the bills, those ones we are actually taking on. We have those bills, some we're already looking at. But the biggest one I want to talk about is the benefit package and the cost of care. We have a benefit package in the country, but we don't have a cost of care. So how can you have a package if you do not know its cost? So I know they're working on that. They have put up a team. We'll work with them to have the cost of care so that one surgery has a cost wherever you go. And I think when we do that, we should be able to get more done. It is its day today, and members of the assembly, so I'll leave it there, because we'll also be taking some notes on what the members say that needs to be done, that we can follow up with him. Thank you, members.
Rachel, take the first 10.
The Honorable Shabir, the Honorable Mother Wangari, number 2, the Honorable Elemengit, can I just do this side? Okay. The Honorable Makali Mulu, the Honorable Member for Kinangop. We wanted 10 here, 10 here, 10. Is that okay? The Honorable Member for Kitui Rural, and that one is the nominated member UDA at the end. How many are those? I started with Shakil. I went to Wangari. I went to Makali Mulu. I went to the member for Kinangop. I went to the member for Kitui Rural. I went to Modoni and Charles CNN. How many are those? We can get another 3 here. We can start with the nominated member. Can we go to this member? Odipo. And the 10th one, the member for Nairobi. 10, Honorable Speaker. So when we start again, we'll come this way and then that way.
Okay, number 1.
Thank you, Honorable Speaker, sir. Aden Duale, Waziri, we have known each other to 2007, and I've had a great faith in what you do, and what you said today, you have convinced me. Mr. Speaker, I want to stand testament today. I put nearly 10 million in NHIF last year. That was lost, but my constant, and Waziri, thank you, and Mercy, thank you. We went and recouped 2.4 million. And that money, sir, is now giving 2,300 applicants, indigents, for 2 months, SHA. Next week, I've promised her I'm coming with 6 million. Now, Mr. Chair, Bana Speaker, I don't have to say this, but I have been diagnosed with a little bit of cancer. So when I went to do my PET scan, I gave my insurance card. They said, no, SHA will pay. I said, they will never pay. SHA paid. The other day I went to take some medicine, 100,000. I went to take some medicine from Nairobi Hospital. I gave my insurance card. They came back and gave it to me and said, SHA has paid. So today, Aden Duale, whatever others say, for me, it is working. Asante sana.
Number 2.
Thank you. Thank you, Mr. Speaker. And Waziri, Mr. Speaker, unlike what we had in the morning, at least this CS had prepared, had done some homework for his presentation to the honorable members of parliament. Mr. Speaker, I am also very glad that the trust deficit in SHA has substantially reduced. But my question, so that I save time, Mr. Speaker, is the issue of incentivized surgeries. The reason Waziri unasema mambo ya CSS in a hospital is because CSS are paid better and so many more times than normal deliveries. Mr. Speaker, we may not deal with the money, but what this is doing to the women of this country. You go pregnant, you're due to give birth. You're told your child is in distress and your cervix is not opening. They don't even try to induce. You are taken to theater and you're cut open. So, because they are paid better. So, Waziri, how do we disincentivize the issue of surgeries? Because we cannot keep doing this to the population of this country. We are opening up women who can easily give birth normally without going to the theater.
Thank you.
Finally, Mr. Speaker, allow me, because I've not asked any question in this plenary. Allow me finally. The issue of doctors and complaints. KMPDU covers their doctors. I have, in the last 3 months, dealt with mothers who have removed fibroids but have been left cotton wool. I don't know what has been left in their stomachs, Mr. Speaker. And lodging a complaint is actually impossible because the KMPD will cover their own. How do we deal with the code of conduct and the criminal negligence of doctors at that level, Mr. Speaker? Because Kenyans are dying and they have nowhere to go for redress. Issue of alcoholism, how do you deal with that in our doctors, Mr. Speaker? Because there is a problem. I would want to hear your response. Thank you very much.
Lele Mengit.
Thank you, Honorable Speaker. First, I want to appreciate Waziri Duale for his perfect presentation. I also want to appreciate what SHA has done. Recently, Honorable Speaker, about a week ago, there is a mzee he's about 96 years old. He had been blind for the last 4 years. And when I visited him, I assessed the situation and he accepted to go for an eye checkup. And it was just a simple issue of eye cataract. And it was removed. The mzee is now seeing. He's been blind for 4 years, and it was fully paid by SHA. Now, my question is, Honorable CS, while we appreciate the government for paying for kidney dialysis, we know patients suffering from kidney issues are close to 10 to 15% in this country. While we appreciate that SHA is paying up to maximum of 11,000 shillings per session across the country, we still have a challenge in settling claims. We have small startups, local companies in this country or hospitals whose claims have not been paid for almost the last 3 months. For example, Oak Tree Center, Kidney Center in Eldoret, Honorable CS, what are you doing so that you can prioritize these startups who are dealing with these issues so that their businesses cannot close down? Thank you, Honorable Speaker. Thank you.
Makale Mulu.
Yeah, thank you so much, Honorable Speaker. I want to join my colleagues in appreciating the presentation, Honorable Speaker. Honorable Speaker, one of the highlights of the presentation which I picked is the issue of consultants charging different rates. And I think to me that is very important that that figure is harmonized. But my question, Honorable Speaker, is on the distribution of medical equipment. I would want to hear from the CS what criteria has been used to distribute this medical equipment, Honorable Speaker. Because, Honorable Speaker, my own county where I come from, we realize that very basic things cannot be done because that equipment is not there. So is it based on needs assessment or how is it done? Thank you, Honorable Speaker.
Thank you. Kinango, is that Kwenya?
Yes, Mr. Speaker. Yeah, thank you, Speaker, for the opportunity, and I join my colleagues in applauding the Minister for his beautiful presentation. But on it, Mr. Speaker, I want to know what the Ministry is doing, and actually it has been mentioned, but not in depth, in terms of harmonization of charges, especially that are being charged by the private hospitals. You realize service like dialysis is being charged at about 11,000 in public hospitals, and that is what SHA is paying for. But private hospitals are charging to the tune of close to 200,000, and I have evidence to that case because my dad is doing dialysis at the moment. What is the Ministry doing to make sure that those exorbitant charges by private hospitals is dealt with and with finality? Thank you.
Kitui Rural.
Thank you, Mr. Speaker, and thank you, Honorable Duale, my friends. I always have a lot of confidence in you. When you are presenting, you talked about the 11 billion, how you are trying to recover that money. But I wanted to hear more on what systems are you putting in place so that this kind of debt is not going to occur again? Because this is money which is supposed to be used to buy drugs and other facilities in the health centers. Thank you very much.
Next, Mudhone Marubu. Is it Mudhone? No, Mudhone nominated. Ikiara.
Thank you very much, Honorable Speaker. Honorable Speaker, I too join my colleagues to thank the CS for coming when he is very well prepared for this session. We laud him for that. Honorable Speaker, my question is, what measures, Wasiri, as your ministry put in place to protect Kenyans from counterfeit medicine? More so, especially those who have chronic illnesses like diabetes, blood pressure. Honorable Speaker, I'm asking this in reference because I am a victim. When I go buying my medicine from the pharmacy, at times I have encountered a case where I bought counterfeit medicine, which when I take it does not work at all. What is the ministry doing to protect Kenyans who are not aware like me so that they don't take counterfeit medicine, which is not working? Thank you.
Nguna.
Thank you, CS, for awesome presentation. We are fully satisfied with what you've done so far. And again, congratulations. Since you took over SHA, it is now working. I have witnessed, because I've had several patients there. Congratulations for that. My question is, how many health facilities involved in the fake claims have you shut down so far?
Kipchumba.
Thank you, Honorable Speaker. I want to first of all declare that I am a health advocate. I've worked with the Ministry of Health in the Vaccine Preventable Diseases campaign. I've been awarded the UN Person of the Year in 2015, fighting and kicking polio out of Kenya and Africa. It has been great. SHA, like the previous program, NHIF, and other health insurances, very little is given to therapies. There's limited package to support long-term conditions. And this in particular, children that have disorders of cerebral palsy, spina bifida, hydrocephalus, and other conditions, and it's lifelong. What is SHA doing to include the essential drugs, medication, in supporting these children, because, or persons, they have to live with the drugs forever, and they can't afford them. And these, most of these, especially anticonvulsants and epilepsy medication, are very expensive. What is SHA doing to expand the essential benefits package to fully cover therapies, especially physiotherapy, occupational therapy, speech therapy, orthopedic therapy, assisted devices, and lifelong neurological medications? Thank you.
Odipo Kwame.
Thank you, Mr. Speaker. I think I have to congratulate our CS. His explanation was quite satisfactory. My first question to CS.
There's no first question, is only one.
Okay.
So just ask one question.
It is one. Now, the lowest contributors in terms of payment do claim that when they go for treatment, they are told they must top up their contribution to cover a full year before they are attended to. I wanted you to tell me if this is what is expected. And do they, or do you cover all kind of treatments? And in particular, I wanted to know whether X-ray is covered, because they also say when it comes to X-ray, they have to pay for that outside the share system. And you mentioned something, Bwana Minister, regarding the medicine, which many hospitals, especially the county hospitals, they do not provide medicine. The problem you have there, you have explained very well, and your intention and what you do. But my concern is, what is happening to these patients if they don't get medicine? Do we just say bad luck, or is there any provision that they can follow to get the medicine they require? Thank you, Mr. Speaker.
Elachi.
Thank you, Mr. Speaker. I also want to thank the CS, to thank his team, Mercy and the team. CS, I was in Kenyatta on Sunday, and I want to thank you and thank Lisiampe. They have done their best, but I realized that because Mbagathi is not functioning and Mama Lucy, you find that we have 100 mothers now delivering a day at Kenyatta. And so my biggest worry now, which is across the country, is how do we ensure to have accountability? First of all, we ensure that newborns are also covered with SHA. Because you cover the mothers, yes, but the newborns, the postnatal, is something we need to look at as also going through and trying to push the hospitals to ensure stillbirth and newborn deaths are really recorded so that we know. And so for me, my proposal will be, in terms of just Kenyatta, is it possible to talk to the president so that these social corporate programs we do under affordable housing, they can just go and do some repairs in terms of their ceilings, in terms of their cupboards, and many other places that I felt it's really struggling. Thank you.
We have done those 11, Minister, because these are very short questions. Let's take another 10 so that we answer all of them. This side.
Thank you.
Hold. Rachel, hold. The CS prefers that he runs through these ones very quickly before we take. To answer Nawe Osoro, so don't grumble. And this side, don't raise your hands. Rachel said she'll deal with the sender first. Then we'll come to you.
Thank you, Mr. Speaker. You know, since I left Parliament and this difficult job, I'm aging. So I didn't want my memory. Honorable Speaker, first I want to thank members for the good comments, and I share that with my colleagues, those who are present and those who are not here, because we work as a team. So it is me and all my whole team that, you know that even there's even somebody who is sitting here making sure that the slides move. It's part of the team. So thank you very much. Honorable Wangari, there's some questions I'll give to the DG briefly and Mercy. Particularly, Honorable Wangari's question, that because of monetary value, because C-section is complicated first, it's a surgery, it's a theater, it's 30,000 reimbursement, but normal delivery is 10. And because of greed, it's a social problem. Somebody wants to force a mother to a C-section when she can do normal delivery. But because he's looking at the difference of the 20,000. So the even though we are developing something called scope of practice, I want the DG and Mercy, she's the doctor, and DG to tell us what do we do, what do we need from Parliament to enforce that we stay within the range of the 10 to 15% of WHO.
Isn't it also an ethical issue?
No, it is, but I think we can do something. The system, Honorable. Two, I think also, I agree with you. Just like the wider society, we have doctors who go to theater when they're drunk. And that's why we are going to pick with the regulator to make sure that we enforce discipline. And I think the system now talks to Kenyans, so Kenyans must help us identify quirks in discipline. You know, patients must also be talking to us. Then on the issue of alcoholism, Mercy, you'll tell us what are the package within the whole range of mental health. What does SHA provide? My honorable from Emma Gwen on the dialysis. Yeah, the dialysis are mainly 2 sessions, but sometimes there are people who do 3. The 2 are fully covered by SHA. But because you have asked me, that facility in Eldoret, I went to Eldoret, I met the stakeholders, SHA was there, we explained to them. Now tell that facility, the owner, next week Monday, to come. We have got a clinic desk at SHA. Every day we will explain to her why we are not paying her. If her money is part of the 11 billion rejection, we will not pay her. Even if she calls the president. Forget about calling her member of parliament. Because we must protect people's money. But we will listen to her. We don't want, and that's why, Honorable Speaker, we're paying NHIF. We don't want also our facilities to collapse. But I think we spoke to that particular facility in Eldoret when I was there. Honorable Makali, my old colleague, consultant rates, I agree. And I think we'll bring a policy or a bill to Parliament for Parliament to discuss. And we'll also take it to the stakeholders, our healthcare workers. But on the medical equipment, it lies with your county governor. First, all the 45 counties have signed for equipment. Intergovernmental partnership agreement. Nairobi County and Kiambu County refused to sign. But I want to report that I think Nairobi County now has signed, and even Kiambu County wants to sign. Then after they sign, they make a request for their facilities. So Kitui County, I agree with you that some counties, their uptake of equipment, basic equipment for their people is very slow. I can give we need to clap for Kirinyaga and Wajir and even Bungoma, where the speaker comes from, Kakamega, PGH, the governor has put 2 CT scans in PGH Kakamega because of the number of people. Let's clap also for the governor of Kisumu, a very progressive governor, Governor Nyang' Nyong and Governor Mombasa. So, Honorable Makali, the problem is, I'll talk to the governor on your behalf to make the request, but please send me the facilities myself. Our honorable member from Kenangop, I agree with you. And the DG must give me and Mercy. There is no way we can have one facility private charging 200,000. Yeah, but the same Aga Khan, the SHA patient, the normal patient SHA, go and pay the SHA patient. But you know, because let's say, for example, me and you and the speaker, because we have another medical cover, so they overcharge us. So you should tell them, charge the SHA as a first point. Yes, the 11,000. But I agree with you, we will make. There's no way we can have 2 sets of payment in this country for dialysis. We will. And please support me when you are also in talking to our people, say, let us use one healthcare. So 200,000, 11,000. I mean, that is a theft and poison board. And you must have seen people making noise in the media. I stood firm. Two, and this is going to affect you. We will not allow drugs that are supposed to be dispensed by a doctor to be bought at the counter. The way me and you and our families call a chemist and ask for augmentin, and then you talk to a boda ride around there and brings you, that will stop. That will stop. Even when you go to Europe on trips, do you buy it on the counter? They tell you no. Even if it's on your phone, they refuse. So because sometimes you are given the wrong drug. Honorable CNN Nguna Shah is working. We have so far closed 1,118. And we are keeping on closing more. Because some of them, they call themselves level 4. They're in a very dingy place. If you look at the theater, it looks like a slaughterhouse. And please help me in your constituencies. Ukiona kitu haikai vizuri kama hospitali, just get me the name. We will ask the regulator, we will ask SHA. First, if SHA will not pay, if we lock them from the portal, they will not survive. Most of these funny facilities have been created to siphon money from the insurer. Honorable Kipchumba, your question I think is valid. I'll ask the DG to answer. And Mercy on the epileptics, the long time conditions of our children. Honorable Depot, the tallest man in parliament. That's what we used to say, Mr. Speaker, in the last parliament. Please don't allow first top up in the primary health care. And now we have put a charter, a green charter. Written walk in, walk out. And we should clap for Governor of Nairobi. He has done that. Without us, he has put a big banner, walk in, walk out. I don't know whether the members of parliament from Machakos are here. Please help me. I always talk to Honorable Wavinya. Yeah, the Machakos Level 5 hospital requires some critical equipment, and her people are not requesting. But at long last, I push them. They have requested for a CT scan. We want them to request for the dialysis to help our people. Yeah, and the ones in Kangundo and all those help us. Yeah, 1 month, you pay very little money, you go to a facility, and then you incur 1 million shilling. If we allow, you walk away, you walk out, and then they go to their facilities, and the facilities will claim a lot of money. It's a whole thing. So, Honorable Depot, we are looking. Honorable Alacha, I agree with you. You know, when there's a Kenyatta National Hospital or Kenyatta University, it's supposed to be a referral hospital. It's supposed to deal with complications even in maternal. When a mother in Pumwani, the doctors are overpowered, then they send to more experienced consultants in Kenyatta. But you know, we had a number of industrial disputes in Nairobi. We are overwhelmed. And I've already told the president that we can use affordable housing to build more wards in Kenyatta and expand Kenyatta. And part of it is even how we can work with the police and take the police hospital along Bagadi Road to be part of Kenyatta so that we can help people. I think, Mr. Speaker, give you 1 minute.
Yes.
Hold there. Kitui Road, can you rephrase your question?
Yes, Mr. Speaker, thank you very much. And I thought my question was very simple. I was referring to 11 billion, which is reported to have got lost. And my concern is, what system are you putting in place to make sure this kind of theft does not happen again?
Honorable, let me tell you, this 11 billion was stolen when the system was young and there was a transition period. From October 2024 to around June last year, July. People went to the system, but they didn't know that the system will do an audit later. As of today, 28th, Mr. Speaker, if you look at the graph of the claims versus the revenue collection, during that time, the claims was 10 billion, the revenue collection was 5 billion. As of last night, the revenue collection is more. The claim is less than even 5B. Because the system detects.
Honorable members, Cabinet Secretary,